basically what we do is quite simple conceptually. That is, I balance a chemistry. If something's high, I bring it down. If it's low, I bring it up. What's the name of the disease really doesn't matter, because if something's high, it needs to come down. Something low, it needs to come up. Now, how you do it, sometimes that gets to be a little tricky. But it is simple in concept, except we've got 64 different chemistries that all relate to the others, so the combination of problems can be 64 times 63 times 62 times 61, etc., down to 1. So you can see 1,000 patients, 10,000 patients, and never see two that are identical. I wish I had time to go into the endocrine patterns that Melvin Page came up with, because a lot of the response that people have to the treatments they're given depends on whether they're androgenic, depends on whether they're hyperthyroid or hypothyroid, depends on whether the anterior or posterior pituitary is the one that is hyper-functioning or hypo-functioning. The whole body is rather complex, but at the rate I'm going, I think I will have all the answers by the year 3000. Okay, let's have the next one. 50 years ago, it was about the time I was in dental school, you didn't hear anything about Lou Gehrig's disease, amyotrophic lateral sclerosis. When I was in dental school, I don't think I'd heard of multiple sclerosis. I know I had not heard of lupus. And Alzheimer's hadn't been invented. Parkinson's hadn't been born. Autism was not a problem. But I remember with Lou Gehrig's disease, my cousin, Miller Huggins, was the manager of the New York Yankees when Lou Gehrig and Babe Ruth were there. So I thought Lou Gehrig was a ball player. I didn't know it was, but it is now. Here's something we just found out recently, that Lou Gehrig's disease is now occurring at a faster rate than multiple sclerosis. So it's really catching up. And I guess I've got a couple of slides before I make a demonstration on that. Here are the current symptoms, the major ones out of the top 200 that seem to be related more to dentistry than the others. If the word unexplained is there, then it is probably of dental origin, because unexplained irritability, unexplained depression, unexplained means that mercury is involved. There are other things that occur too, but we're kind of working against ourselves. If I have time, I'm going to hit cholesterol. Cholesterol is one of the most important defense mechanisms we have in the body. And the bad cholesterol is what makes estrogen and testosterone and aldosterone and cortisol and things like this. That's bad. This is the biggest fraud. I have a 2-hour... I do appreciate that, because I have spent countless hours working on cholesterol. We have put together a 2-hour CD. I did a 3.5-hour DVD and found that was kind of overkill. But it is all from the scientific literature. And none of it says anything about cholesterol being bad. The only bad thing about cholesterol is not having enough. Melvin Page taught me in 1968 that the perfect cholesterol level was 222. Today, the perfect cholesterol is 222. It has not moved. Now, the normal has gone up and down all over the place, because as you get down to about 120, you can pretty well be assured that 100% of that population has cancer growing someplace. It may be small, it may be large, but it is growing. So they decide we can't have 100% of the population with cancer, so we've got to come up. And there is an awful lot of material that is shown where the committee that tells the physicians where cholesterol should be, the head of the committee, Richard Pasternak, receives payoffs from 9 statin manufacturer companies. And that's the least, because the rest of the committee gets payoffs from more than 9 statin manufacturing companies. But to digress a little bit, red blood cells are 7 microns in diameter. They go through a capillary that's 5 microns in diameter. How do they do that? Well, they fold and bend upon themselves and slither through there if their membrane contains 23% cholesterol. If it drops to 21% or below, it does not bend and fold, and it creates little mini strokes all over your body. So one of the biggest defenses against stroke is cholesterol. Depression is directly related to how much serotonin is in the body. Who controls the amount of serotonin that's manufactured? Cholesterol. The HDL cholesterol is supposed to be the good. Yeah, it's good. What's the difference in the chemical structure of HDL and LDL and VLDL? Nothing. They are all the same structure chemically. HDL, high density, means you squished it down a little bit. So it's a higher density in a smaller area. But as far as being the best protector against heart disease, against stroke, against cancer, you're not going to get over cancer unless you get the cholesterol levels above 200. 180 is kind of the borderline area, the break even, if you would. But if we have a patient who stays around 120, 130, 140, I know they are not going to recover very rapidly. But we can move cholesterols. Our first chemistry and our second chemistry are 6 days apart. And I can move cholesterols. I say I do. Actually, it's a patient that's doing it. They can move the cholesterols 100 points in 6 days. And that's without any, okay. You're taking an insurance physical. You've got to have your cholesterol less than 180. A couple of ways to do that. Take 2 days before that and eat nothing but meat, eggs, and butter with a lot of salt on it. And you do that for 2 or 3 days. Then, if you really want to drop your cholesterol, now I don't remember the figures exactly here because I hadn't planned on presenting this. If you have your blood drawn standing up, you'll have X, you'll have a certain cholesterol level. If you lay down, you just dropped or if you sit down, you just dropped your cholesterol level another 12 points. If you lay down, you dropped it another 8 points. So you can drop looking at it totally, I think the total spread's like 36 points from whether you're standing up or really stretched out and relaxed. And about the best they can do with some of the other materials is 3 or 4 points with your statin drugs. So that whole thing is the biggest fraud that's been perpetrated upon the United States up until what was signed into law a couple of days ago. Chronic fatigue, that's an old figure from several years ago. It is now up at 92%. And there are a lot of ways that dentistry creates chronic fatigue. Just putting the mercury on the thyroid hormone. Sure, you've got your T3, you got your T4, but no activity. T4 is actually your storage bin, and T3 is your active component. Unless it's got an atom of mercury on it, then it is not active for you. Hemoglobin has 4 binding sites to carry oxygen. Oxygen jumps on, jumps off with no measurable energy exchange. It is very, very, very low. But if mercury comes along, what I learned in immunology, the scientific term for an attachment that's very strong, is that mercury will glom on to the sulfhydryl binding sites within the hemoglobin, or directly to the iron. And then it rides it for the full 120 days. You get no exchange of oxygen, and yet if you take your hemoglobin, your red cell, your hematocrit, they all appear to be maybe even above the level we're looking for, because you've got an awful lot of mercury, so you don't have much oxygen. And in that situation, your Coulter counter is useless to you. How do you measure it? Oxyhemoglobin is a good way to measure, because it shows you the actual oxygen saturation on venous blood, not arterial. But you know the magic little thing that you put on the finger and it tells you the oxygen level? It's not reading the oxygen level. It's showing you how many binding sites are full of oxygen, of mercury, of nickel, of stuff from root canals, but it is not giving you, I'm not going to say throw them away. No, they do have value. If it gets down below 50, hey, you got a problem going on. But as far as oxygen saturation, be advised that is not telling you oxygen saturation. Oh my. Each one of these could take a lot of conversation, but these are some of the major ones that we are finding that will reverse within a few days of applying the whole program. Now, these are diseases that are definitely of dental origin, according to my opinion. I don't think you're going to find it in the ADA journals, but any of these things, I will be describing breast cancer in detail, but we have many, many cases of all of these that appear to be of dental origin. And if dentistry is not confronted here, these diseases are going to respond either temporarily or not at all. I had a couple of educational experiences with this little chart, and the one thing that I cannot find now is charts like this. You notice that this goes up to, 2005 to 2000? What happens after 2000? Well, we haven't had time to put the material together yet. We've only had 9 years where every year they could do it before. All right, Lou Gehrig's disease is bouncing along here about the same. Oops. Then in 1976, took a big jump. What happened in the year 1976? That's when the ADA patented its new high copper amalgam, which puts out mercury 50 times faster than the conventional amalgam. Okay, it goes up, and then 1991 it goes off again. What happened here? Well, we had the Gulf War, and I did raise a bunch of money. We brought some people over from England who were terminal with Gulf War disease, and it's the only thing I've ever done in my life where we had 100% success. But we did turn around every one of those we brought in from England. And so I thought, 91, hey, this may be the time that with those immunization shots full of mercury, they got 16 of them at one time, and of the people that I've canvassed, which is several hundred, they said that 20 to 25% of the soldiers that were vaccinated were in the field hospital within 4 hours of the vaccination. So what'd they do the next day? 16 more vaccinations. 20 to 25% in the field hospital. So what'd they do the next day? And all this was signed on, was not stopped because of the work of our immediate past Vice President, Dick Cheney, that nobody was going to stand up against him and say that there was anything wrong with it. So I thought that's what's going on. Do you know what happened in 1990? In 1990, the ADA made a suggestion that dentists do 30 million root canals a year. And what happened after that? We started doing more root canals, and that's still good. Now I understand they have raised the bar to 60 million root canals a year. And we have several diseases that show these same things. In 76 with the high copper amalgam, 1990, 1991, when everybody started doing more root canals, headed up off the charts. It's difficult to find this information, but I have a gal working for me. This may not be exactly true. It may not be a right decision, but she seems to me the type of person who has gone through her life getting up every day, meeting the challenge of motherhood, of wifehood, of working at a job, and so on. And all of a sudden, with absolutely no training in microbiology, she has become our bug lady. And she has a passion for getting into the web and finding out what these bacteria are doing, and for finding graphs like this. This is what she does at home at night. She's really nuts. But she has a passion for this, and she has. She didn't bring me this graph, but after seeing this, we have one that looks just very similar to it for leprosy. You didn't know leprosy was on. How many people were aware that leprosy was on the increase after 1991? One person. Okay. Two. Diabetes, same thing. There's a notch at 76 and there's a notch at 91 that diabetes is on the way up. Most of these autoimmune diseases are going up at the rate of 10% every year. So at the end of 10 years, hey, that's a pretty good size. Well, all right, let's look at some of the bacteria that we find in ALS. And this is what they look like. This column over here on the left is going to tell you whether they are present or not. I was going to say, where's the rest of it? Yeah. This is the bacteria that was found in one root canal.
On an ALS patient?
Yes. On an ALS patient.
On an ALS patient, yes. And this is one that had the fewest number of bacteria that we have studied.
These all anaerobic or aerobic?
These are all anaerobic, yes.
I bet that tooth looks real good on an X-ray also.
This guy, these are pretty dangerous. Those are strepmitis. I just found out some stuff about strepmitis that I'll go ahead and tell you about now. This is still the same root canal.
How were you able to isolate all the different bacteria, viruses? How did you isolate?
How did you isolate the different bacteria?
These are all isolated with a DNA test, where you're doing DNA testing for anybody that happens to be present, and it's called protease polymerase Why'd you have to ask that? Polymerase chain reaction is the official name of the DNA testing that's done, where they take a sample and go through and see how many different matches they find on DNA.
Which laboratory does that? I'm sorry, can you repeat the question? Which laboratory doing that?
Which laboratory does that?
Which laboratory does that? Probably shouldn't give the information out because they're one of the few places around who's not aware of the definition of the word Huggins. It's done in a university environment that happens to have a dental school too. So they have their DNA testing because they're testing for periodontal disease, but they're doing the medical test for me, so I get the dental and the medical test. And we're only testing for 87 bacteria, but there are many more. My little bug lady found out the other day that a Clostridium, you may have heard of some of the Clostridium, like botulism and tetanus. Okay, Huggins theory is we're going to find a whole lot more of those involved with our neurological population. And we're getting about 2, and there are about 150 that Carolyn found out are available. So I would love to have my own laboratory. I've had my own laboratories in the past a couple of times, and if I could have one to do some of the things that we're doing now, I could stir up a lot more information than I am just with this. But these, as we go along, I think I can show you have some significance that we should be paying attention to.
How many did you have in that one ALS root canal?
How many did you have in the one ALS root canal?
The most we have found with ALS is that hers?
This is hers.
I think was over, checking a few more then, over 100. This is the kind of report that we are putting together now with the materials. These are all ALS?
Yes.
These are all ALS patients. And then what we have done at the end of it, I'll leave this around to be at the booth if you want to come take a look at it. For each one of the bacteria that we have identified so far, here are the write-ups, and in highlight the more significant things that, hemoglobin and heme are destroyed by this guy, release potential sources.
Use the microphone, please.
Can you get over here? Don't wander too far.
I get all excited about that. I'm almost as bad as Carolyn. But then we have page after page of the report, and the highlighted ones are, meningitis and heart disease and more meningitis, invasive infections, more meningitis, all kinds of things here. Different bugs that create meningitis and other central nervous system effects. All these patients have ALS. So is there a relationship here? And this is not only from the root canals, but from the blood and the cavitations. And as I mentioned, now we're taking out the tooth, analyzing what's on the end of the tooth, and then analyzing the blood that's behind it, which is another reason I don't want the information out, because they don't test blood, but they're testing what we send in. We don't tell them what it is, but that's where the problem is. And this is why you go in and take out a tooth, and if you scrape it instead of taking a burr to it, you push these toxins out into the body, and the patient gets real sick for usually 6 days afterwards. But it's just because you take out the tooth, and if you go in and take a burr and cut that out, and you got the IV going, you still have a quarter mile of bacteria in the bone there you haven't taken care of yet. And who takes care of that? The lymphocytes, the polymorphonuclear leukocytes, the eosinophils, the basophils. So you've got to be nice to the immune system to stimulate that to go into the areas, because I tell many people the only way we can get all of the bacteria out is to remove the whole head. We do draw a line there for the dentist. So somebody has to go get the rest of it, and that's what detoxification means to me. Yeah, I want to get rid of some heavy metals, but there are a lot of ways to do that, and a lot of ways that create a whole lot of problems for us. But it is the combination of heavy metals and the toxins from the bacteria is where the central locus of the problem is. Do you think I'm getting off? Oh, okay, here are some of the bacteria that we have found in multiple sclerosis. Okay, anybody have their foot in the aisle? Whether it is or not, I'll probably step on a few toes, because we have found for some reason or another, and I don't have an explanation for this yet, more than what you might expect, relationship between Alzheimer's and implants. Autoimmune disease and implants, yes, but a little bit higher in Alzheimer's than you might anticipate. Okay, let's look. What we do with an implant is we take the implant out and then take a sample of the bone right immediately adjacent to the implant. And if you look at some of the selected bacteria here, now, I've had a couple of courses in microbiology, but the one thing I did not learn was how to pronounce some of these names. So I invent my own names for them, and sometimes if you have microbiologists in the crowd, they're kind of insulted by my names. You know, it's like there's a Clostridium, Difficuli. It's Clostridium difficulty, as far as I'm concerned. So they're up here. I'll pronounce what I can. But Camilla, what does it? It's one of the bacteria around implants. Meningitis, acute invasive infection of the lining of the blood vessels. This one, the lining of the blood vessels. Prevotella contributes to heart disease. Staphylococcus contributes to the disease of the heart valves and also endocarditis. Now we do see with a lot of these autoimmune diseases sinus problems, and I do run into a lot of these bugs that do give sinus problems. But here's the heart again, myocardial abscesses, brain swelling, infections like abscesses and bacteria at wound sites, post-surgical, which would be taking these things out, taking out teeth, or with periodontal disease. You know, there's a lot of information appearing in the literature now about periodontal disease and what it contributes to. Well, these bugs, even going down 3 and 4 millimeters in the gingival area, can become anaerobic. And the same bug can go another 4 or 5 millimeters, run into a lower oxygen concentration. You have maybe 19% oxygen at the sulcus, drop down 4 or 5 millimeters, maybe you're at 16, and by the time you get to the apex, you're at 0. These microbes have the ability to undergo what is called a pleomorphic change. A pleomorphic change means change in the inner self, but the outer self, inner self stays the same, outer self changes. All right, butterfly. You take a worm, it crawls into a cocoon and crawls out the other side as a butterfly. Well, presuming that butterflies have souls, which may be open to interpretation. But let's say that the worm has a soul, it goes through the cocoon phase, comes out as a butterfly, it has the same soul but an entirely different body. That's what the bacteria do. As they get into greater anaerobic conditions, they're going to die, but they are smart. They don't die. They change their internal mechanisms to live with less oxygen so that they do end up surviving, but they are now identified as a different person because they have changed their DNA. How do you change your DNA? You form a plasmid. Now, if you look around, there are dead bacteria all over the place. So a bacteria that is in trouble looks around and it finds a piece of DNA over here, picks up that DNA and tacks it onto the bottom of its shoe. There may be some poetic license here. And so it now has an additional part to its DNA. So it's its original plus the plasmid, which means that it is a different type of bacteria now. And when it duplicates, when it replicates, when it multiplies, the plasmid is multiplied with it. Now, if we go back a few years, we came out with antibiotics. And the antibiotics, after a few months, the bugs are resistant to it. So we form what's called the Antibiotic of the Month Club. We come out with new antibiotics, and it's not long till they are, the bacteria are resistant to the new bug, to the new antibiotic. What's happening is that dentistry is putting mercury into the body. Mercury is going to kill bacteria. Bacteria do not want to die, and bacteria, believe me, are much smarter than human beings. They can figure things out in a matter of a day or two, change their body form, change their DNA, change their structures. We can't do all of that. So mercury is going to kill this bacteria. He doesn't like that. So he puts on a plasmid, and he can take that mercury, the ionic mercury, and convert it into methyl mercury. Methyl mercury is a light vapor. It runs up to the top of the bacteria and gets excreted out of the bacteria. Okay, so the bacteria survives. Now, the host, which is us, may not survive because we're getting more of the methyl mercury put into us, but the bacteria survived. Incidentally, when it becomes resistant to mercury, it simultaneously becomes resistant to antibiotics. So it is dental mercury. I think it was Ann Summers who presented this sometime back, about the time I was taking my master's on this. Her articles came out proving that. So, yeah, not new information. You think I can hear you from back there? I can't hear these people. Can you listen to what he is saying?
Go ahead.
Do you find that the bacteria living around implants is any different with different materials like the zirconia?
Good question. My professor of immunology made a comment one time which I didn't like, because at that time, by my own modest admission, I was pretty good at doing implants. And he said, anything implanted into bone will create an autoimmune disease. The only difference is the length of time it takes. And I just stepped on a whole lot of other toes, but I'll blame that on Dr. Schwarzenegger. Schwarzengerber. Yeah, something black. And we have certainly found that to be true. Now, the bacteria that occur around the implants, I have not been able to differentiate the difference between whether it is stainless steel or titanium or what. A lot of the same bacteria show up in the same places, but there is a different grouping that occurs around the implant bacteria. And Unfortunately, these are a little expensive, and as Tom Levy said, my research is sponsored by Hip Pocket National, which is my own. We have had 4 or 5 patients who have made substantial donations to the Toxic Element Research Foundation, which now has, my account should have $23. It's $23 in that account. Well, every time I send in a plate of one of these things, I've just obligated myself to $4,500. And so we do have 118 cavitations, and we see that there is a difference between cavitations and root canals. But as I mentioned earlier, my working philosophy is that these guys are working together as groups. And that's why I'm talking about, I'll find heart here, I'll find brain here. We'll try to put some of these together and see if we can determine who the groups are that are working together. I don't know where antibiotics fits in here, if I have a section.
This one and the next one.
Oh. I love this. Because of what I mentioned a while ago about cholesterol, this really irritates me of the fact that we have been, boy, talk about photography. We got a lot of pictures going. Yes, you're absolutely welcome to do that, just don't use my name. Because Lipitor, hey, we're all in business to make money, okay? It just so happens that some of these companies, by lowering the cholesterol level recommendation 10 points, the next year made Pfizer, who makes Lipitor, $32 billion more. 1 year, $32 billion more. I'd like to have some of that. Maybe just a few $100, but I don't need the billions. But do they need the billions at the expense of creating all these diseases in people? My opinion is no. They don't, even if their patent is about ready to run out. But they, now I have done, well, I told you, I have 200,000 data points of information. How many of those are cholesterol? I don't know, probably something between 5 and 20,000. I've seen a lot of cholesterol levels. I have seen fewer than half a dozen above 500. Now, in the studies that Lipitor published to show how great it was, they took cholesterol levels of like 1,500 and showed that they could drop it 23 points by taking Lipitor for 30 days. You can lie down and drop it more than that. You can sit down and drop it more than that. So I do not consider these as valid studies of proof. If you want valid studies of proof, match the things that we do, the 64 tests that we do. But what they'll do is go through and find one test that doesn't move much and say, see, here, liver function is not really hurt very much. You think that doesn't hurt liver function. How does it work? By disturbing liver function. But if you get enough liver function tests, you'll find one that doesn't move but 5 or 10 points. And then you look at things like in the warning, it says if the enzyme levels for liver function go 300% higher than the highest maximum allowable, reduce the dosage. Don't stop it because you're about to kill the patient. Just reduce the dosage, but keep giving us money more every day. The Lipitor is not cheap. Should I get off my soapbox? Does everybody understand where I'm coming from on cholesterol? All right. Now, with the antibiotics, hey, it's very simple. We have a whole lot of bacteria. If we just had 1 or 2, we could use an antibiotic that targeted the one bug. But we have a lot of them, so why don't we use a broad spectrum antibiotic? Well, I saw things happening with people taking broad-spectrum antibiotics. They got really sick. They really were miserable. What was happening? What was happening was, as you go in and start killing, okay, we got a couple of bacteria over here we really need to wipe out. And it's kind of like in the bank. There's a bank robbery, and the security officer comes out with a machine gun and kills everybody in the bank. He got the bank robber, but he got about 50 or 60 customers too. This is what we're doing with broad-spectrum antibiotics. We're killing off the customers. You take the bacteria that are not particularly harmful, and you destroy those. And they have an external body. They have a shell around them called a cell wall. And this becomes fragments. You get a lot of fragments, and these little fragments are called lipopolysaccharides, LPS. And these little fragments frequently do more damage than the original bacterial toxin was doing. So by using broad-spectrum antibiotics, we go out and create a broad-spectrum disease that we did not have before. And how are you going to treat that? Increase the amount of antibiotic. Change to a different antibiotic. Kill off a bunch of other things in here. So antibiotics, yes, antibiotics are necessary. Hey, if I've got pneumonia, give me penicillin. Yeah. But we have gotten to the point where we give too many antibiotics without a good enough reason. And I know in my studies when I was in school, what I learned about antibiotics did not tell me when to use it, and more importantly, when not to use it. You go to the doctor, you've got a problem. If you leave without a prescription, you did not receive proper treatment. This is kind of what the mindset is. Watch television, and there are lots and lots of drugs that every one of us need every day. Ask your doctor if Lipitor is right for you. The ones that provide calcium for bone metabolism will give you osteoporosis. So we are not being told the truth. And anybody who does puts himself in the crosshairs. If you'd like some personal recommendations, I can tell you. Now, when you have unleashed these lipopolysaccharides into the body, what do you find? Well, they're in the outer membranes, mainly of the gram-negatives. The gram-negatives are the anaerobes that give us the most problem. However, that may change because Clostridium, which I figure someplace in there, we're going to find some bugs that are really bad for ALS and MS and other neurological diseases. I think they are in that particular group. Those are gram-positives. So even though most of them are gram-negative, that does not mean gram-positive gives you the safety factor. These lipopolysaccharides are called endotoxins because they come from inside the bacteria. The exotoxins are why we're giving the antibiotics. And the LPS, the result of that is vasodilation. The vessels get real big, your blood pressure goes down, you go into shock, and you're dead. And so this is what can happen by an overdose. It used to be when I was in school, we gave antibiotics for 4 days. Now you give it for what? 4 years? If you're a teenager and you've got zits on your face, you got 2 years worth of antibiotics. I don't know how kids live through that next 2 years for all the things that antibiotics can destroy in the body. Now, they got a bunch of mechanisms here that are interesting. One of the lipopolysaccharides is called leukotoxin. Now, in the test that we're going to be handing out for you before long, you'll have to know about leukotoxins. But in the final case that I'm going to present here, it will be important to know about leukotoxins. They are specific porins. What is a porin? P-O-R-I-N is a toxin, a chemical that burrows holes into cells. Let's keep this in mind. It'll come back. They inhibit cell division and destroy the chemotaxis of the white blood cells. White blood cells sitting there at the side of the road like taxis, waiting for something to happen. Okay, something happens up the road, and a chemical comes down that says, we need help up here. Oh, okay, so the white cell goes up there and starts gobbling up what shouldn't be there. That gets stopped by the lipopolysaccharides. As a hemolysin, that is the action of the porin. Hemolysin means you are getting rid of red blood cells. How are you doing that? By drilling little holes in the red blood cells so the hemoglobin leaks out of it. Creates inflammation around dendrites. Do we need dendrites in autoimmune and neurological diseases? They're important. So this can be the action by using too much or too broad spectrum an antibiotic. White blood cells secrete cytokines, which we really don't need, and it dissolves connective tissue. Connective tissue is what connects us, keeps us connected, body and soul, keeps all the body connected there. So these are the things that don't say never use an antibiotic. I mean, I haven't used an antibiotic in years, but until last week when I lost my voice. And to me, this is the most important meeting that I have spoken to in a long, long time. And of all the people I have seen here that I've known but haven't seen for years, it was worth it to take an antibiotic to get my voice back. So, yes, there are times that you take them, but how many did I take? I took 3 250 milligram capsules, and then I took 1 500 of amoxicillin. And I don't know who built the walls in my house, but I tell you, they weren't real stable last week. They were moving around when I took that 500 milligram. So my weight is lower than it's been in years. I finally broke the 200 barrier. I'm now 199.5. But at basically 200 pounds, 500 milligrams of amoxicillin is more than my body can handle. Now, if I had taken a lot of medications over the last few years, no problem. But if you don't have amalgam, you don't have root canals, you don't have the dental stuff in your mouth that shouldn't be there, you must alter the amount and the duration of the medications that you're giving, because it's very easy to over-medicate, in particular with the antibiotics. Okay. All right, Blanchy Poo. I do cross swords with people once in a while. Cross swords with Blanche Gruby, because she was saying, as I had heard before, that breast cancer is related to root canals and the bicuspids. And my answer was that the toxins that I am finding in any root canal are powerful enough to completely override the meridian system. Well, I found out that we were both right. She's probably right 80% of the time, me 20. Because of the root canals that we have removed on women who either have breast cancer or have had breast cancer, about 80% of them are bicuspids. So, yes. But there is that other 20%. So it can override, but the bicuspids are primary. Root canals and cavitations are not all the same. I want to diverge away from this and I've got a slide to tell me where I was, but this is very important. I talked to an MD. His wife had multiple sclerosis. He brought her to see us when we were up in Montreal. And, well, fairly open and shut case here. She's never had any dentistry done. She's, I don't know, women's ages kind of evade me, but I would say she's in the vicinity of 35 to 40, give or take 20 years. And it's quite simple. She has no root canals, 28 teeth, no amalgam, no crowns. Where does her MS come from? Cavitations. I said, yeah, this is pretty simple. You got your 4 wisdom teeth have been removed, and you've got 4 cavitations there, and here's where the problem comes from. And she says, no, my wisdom teeth never formed. Huh. And cholesterol on my face. I mean, egg on my face. Oh, okay. Tell you what, the crown of the tooth is made from one germ layer, ectoderm, and the root is made from mesoderm. Now, mesoderm is compatible with bone. Ectoderm from the crown, not compatible. So we've still got seeds down here of the wisdom tooth that for some reason or other didn't form. And so we have an autoimmune response. Remind me about age 35. So we have an autoimmune response going on here that is taking the form of multiple sclerosis. He says, that's really interesting. Where did you read that? Well, I didn't. He said, well, how did you learn it? I said, well, I just now made it up. And he says, it sounds reasonable to me. Go ahead and operate. Operate on his wife, not on him. See? So it was an easy decision for him. So we went in, and sure enough, now, the hardest person to convince was the dentist. I don't see anything on X-ray. I'm not going to do that. Put my life on the... I know what turns him on. I said, I will personally give you cash, $125 for each hole that you drill in those 4 areas if you find solid bone. If you find cavitation, you charge your ordinary fee there. I've still got my money. Because out of those 4 third molars that did not erupt, 4 of them were cavitations with kind of funny looking goo in them. But we cleaned those out, and yeah, she went ahead and responded to the therapy. That was fine. Now, to this date, then you'll take her question. I'm doing all right if my watch is still running here. I quit counting here a few months ago, but at last count we had 76 out of 82 areas where wisdom teeth had never formed that were cavitations. So it's not 100%, but it is certainly well above 90%. And he has a question.
Did you image any of those with a cavitat?
Yes. Yes. And the cavitat showed nothing on those.
We recently know in genetic testing, which is 100% accurate, that MS has a genetic link, which is only shown if you have vitamin D deficiency. Because vitamin D creates a protein in the DNA which stops MS. I agree with you totally regarding the ectoderm and the wisdom teeth. There's a connection there. And we have in Canada the highest rate of MS in the world per capita because we don't have enough sunshine.
Even higher than Colorado? I thought we were number 1.
We have no sunshine.
Okay.
So what I'm saying is there's a big connection between vitamin D and MS. And it has been proven. It's in Oxford University. Even the American and Canadian medical journals agree with that. So there's a big connection between the ectoderm and vitamin, having MS, and also lack of ultraviolet light. That's why I said, got to add vitamin D there. Now, secondly, if I may, regarding all the...
May I address that before we go into a second one?
address the genetic...
For a second question?
Of course.
Yeah. The first MS was described very, very accurately in Paris, France in 1832. And the first commercially placed amalgams were placed in Paris in 1832. Now that may have been the year that vitamin D was declassified or something. But if you look worldwide, the Bantu in Africa, there are 12 million of them at last count I heard, which was 10 years ago. There were 0 cases of MS, and there were only 100 people out of the total population who had amalgam in their mouth. So I think that mercury does have, mercury may knock out vitamin D too. That's a possibility.
Well, see, what happens over the ages, according to Western prices, what we know now, we like pleomorphism, which I've been working on for over 20 years. Pleomorphism is the right word. Now, as we expose the population to these heavy metals, we see our kids now, the newer generations, they're more liable to for genetic disorders. So we are toxifying our DNA. Now, coming back to your entire lecture about these bacteria and infection in root canals and implants, well, I totally agree with you, but it depends on the infection of that implant site. Not all, because a couple of years ago I went to a very prestigious conference put on by a very prestigious implant company. Unless they were lying to us, they showed us multiple electron microscope slices of implants on healthy, properly placed implants. The pictures I saw there, I totally agree with you. They're like periodontal disease. Now, heavy metals and the bacteria creates a milieu, which is an environment which creates a certain type of pleomorphism in the type of bacteria. Dr. Enderlein proved that like 80, 90 years ago. I totally agree with you. But it's the whole environment that we create with the metals and the bacteria which creates the disease. Now, the company showed with the proper titanium implants and the proper phosphorus coating, they showed under the electron microscope many slices, osteoblast, osteoclast activity, all normal functions, hematology, etc. So I come from that conference, and they had many slides, and then I come to this conference. I agree with you, and I kind of agree with them. The thing is, we have to have a solution. We can't just rip teeth out because I happen to be a structural person. When you don't have teeth, you create other disorders in the body. So we have to have a solution.
No, we don't really have time to get too far into this, but as I said, I'm going to be stepping on toes. What I'm doing is showing what we find. And with the implants so far, we've never found an implant that had less than 42 bacteria. But the thing is, if you look at it under an electron microscope, you have killed the anaerobic bacteria before you got it on a slide. So DNA is the only way to really be able to tell, but a very inexpensive way to tell what an implant is doing is take a CBC. $20, $25 will pay for a CBC. Take it a day or two before you place the implant, then take it a week after it, and send those to me and let me interpret them, because the wide range of normal is not going to tell you anything. But the changes between the different populations of white cells, I would like to see that. Because my maximum bet's 4 nickels, but I would bet my 4 nickels that I can show you changes that are significant. And I don't mean statistically significant, I mean highly significant. But there's a very easy way to tell. Electron microscope does not tell you what's going on in the body. The CBC does. So do that next time you're placing implants and let me see the results. Because if this only happens 50% of the time, it's like Boyd Haley told me, if you have seen something happen 6 times, you are in the 99 percentile of it's going to happen the 7th. And we have 9 implants that have shown the same thing, anywhere from 42 to, I don't know, 60 or 70 anaerobes there. So, yeah, I am perfectly willing to take a look at the CBC, because then you're talking my language. And if they work, hey, that's fine. Because I have not had anybody yet where I'm talking about take out a root canal tooth, but what they say, what are you going to put in the hole? I say, that's what dentists are best at, is filling up holes. I said they can put in fixed bridges, they can put in removable partials, there are all kinds of things that can be done. That is not the problem. The problem is leaving it in from my aspect, which is very limited, but it's farther down the line than what you got.
See, I agree with you. You're seeing the pathology.
Mm-hmm.
I have seen thousands of well-placed implants. Literally, I could show you periodontal attachment to these materials.
Mm-hmm. You're forming the calcium around there as a shield.
It's periodontal attachment. I mean, I'm a scientist, I'm also a practitioner.
Mm-hmm.
But there are many implants. They are terrible, especially when you place them in the root canal site. I've said at this conference like 15 years ago with Edorana, you do not place an implant when you have a root canal tooth unless you cavitate properly. And now, the last several years, we have ozone. You put ozone, you put pleomorphic products. Then you check it with the intraosseous neurotherapy, with bone density, and you put the remedies properly. Then you place it.
Okay, if you don't mind, let's talk about that later and let me finish my program here, because I just have a few minutes to finish here. But yeah, this is open to interpretation, to argument. I'm just opening up an aspect that we have spent several years on and many thousands of dollars with, and we're looking at the porphyrins, we're looking at the DNA, we're looking at a whole lot of different areas that I feel constitute what I call biological dentistry. Okay, here is a breast cancer patient that has taught me a bunch. Is Dawn here? She's out there. This is the part that I told her I did just for her. This is material that we didn't have last week. So this is current. Now, this is an actual breast cancer patient. And you have, okay, that's fine. I just need to know where it was. I'm more comfortable if I know where it is. All right, so combining things here, we have white cell counts before treatment of, we do have monthly, yes, 2,700. Now, what is the stability point? You know, the normal range keeps getting wider and wider and wider every year because more people are having amalgams, high copper amalgams, more people are having root canals. So, yeah, there are more reactions to white cells and there are more of the reductions here because of fatigue of the immune system. So 5,300 is the stability point for white cell count. So we start out with white cells of 2,700. We're going to clean up the mouth here, and we're going to see that increase. It increased all the way up to 1,700. Oops, that's not going the right direction. So a month later, it came up to almost 2,200. Still had not really recovered. Lymphocytes, 880, should be around 2,200, dropped down, came up, but not real significantly. Lymphocytes are the ones that go around, place flags on dead tissue saying, come get this and take it away. And the PMN is the trash company that comes by and picks things up. Should be around, when you're treating a patient, 3,000 to 4,000 is not a bad area. 5,000 is not bad because it's got a lot of stuff to clean up. Is that Dawn over there? Yeah, this is the material that we put together in the last week that I said I did just for you. This is on a breast cancer patient. And it's kind of where we're beginning to show how these things fit together. So if we look into the root canal, we have a hemophilus, and what does it do? It increases the white blood cells. It increases the PMNs. Endocarditis does have a high mortality rate, so it's not too friendly. Well, wait a minute. It increases the white cells, but they dropped. Increases PMNs, but they dropped. But that's not the only bug that's around. The Corynebacterium diphtheria, about 27% of the root canals and cavitations that we have samples on have diphtheria in them. What's diphtheria doing in a cavitation? These are the questions that we're beginning to ask. But Corynebacterium, what does it do? It kills activated T lymphocytes. Well, we've got some activated T lymphocytes here. That kills them off. Staph aureus, that's a real bad one. It kills white blood cells with a leukotoxin that we mentioned a while ago. Pokes holes, makes porins, pokes holes in the white blood cells, especially with breast carcinoma. It's also involved with endocarditis. I wonder if that goes back to the Lipitor stuff. And leptotrichia, it lowers the white cells. So we have 3 bacteria that lower the white cells and 1 that raises. All right, who won? Look at the chemistry and find out. But just a couple of days ago, that one may be easier for me to. Just a couple of days ago, we found that the white blood cells have now gone up to 2,500 from the 2,100. The lymphocytes have gone, they did not give us a lymphocyte report on that, or the PMNs, but we did have a slight recovery. I mean, 2,500, if I had 2,500, believe me, I'd be petrified, but relative to what she's been through, okay, we're seeing some improvement here. Now, this is kind of interesting. The blood glucose is levels are directly related to the speed at which cancer is growing. And the areas in which it does the most damage are within the normal levels. But with a glucose of 92, hey, I know why it's up there. She was doing that. Okay, she's going to correct things, and we're going to get that glucose down, all the way down to 95 in 1 week. Then at a month, it was up to 101. It should be down around 75 to 85. All right, what's happening here? E. coli is present in that root canal, and it produces toxins that are identical in structure to insulin. So the body thought that there was plenty of insulin, so it quit manufacturing as much insulin, and even on a diet that is absolutely guaranteed to bring the glucose down, it didn't bring the glucose down because the body thought there was plenty of insulin. There wasn't. It was an imposter, and the glucose came up. Now, as of this past week, her new glucose level is 81. So what this is showing is that our detoxification was wrong. And now what we are doing, I have just called the dental area, and I said, from now on, you give intravenous vitamin C while you're doing the procedure. Within 24 hours, you give them another 50 grams. Because we're not hitting them hard enough at the second day. We were waiting till the third day. That was a mistake. The second day is when you need to go in and start wiping these guys out. Now, with red blood cells should be 5 million, 3.9, 3.5, 3.8. We're low. The hematocrit, which I consider one of the more important tests, that's the percentage of blood that is actually composed of red blood cells. Hematocrit went from 37 to 33 to 36. When you hit 42, that's when you got chronic fatigue. Anything below 42% on a hematocrit, you have permission to have chronic fatigue. Are going the wrong direction. Anybody who'd like to try to pronounce that, please be my guest. We call it AA in our office. It forms porins. It has a high appetite for iron, so it pokes little holes in the red blood cells and sucks out the hemoglobin so it can get the iron. And the result of this little guy is to sustain disease and infect heart tissue. E. coli also produces porins. And porins are produced by the Clostridium difficulty, as I call it, Neisseria, Heliobacter. In fact, does the next slide show all the porin? There are a lot of bacteria. All of these microbes can create porins. So if we have problems with red blood cells, then here is the list to start with. And we're just at the beginning stages. You know, I've been doing this for 2 years, and I've probably learned 50% of what I know about it in the last 3 months. So our learning curve is getting where we're finally finding where we can see the information on what these bacteria do. And now that I know that porins are related to red blood cells, if I got a problem with red blood cells, I know I've got to do something that's going to affect these guys without giving them antibiotics. All right, what about protein metabolism? BUN, blood urea nitrogen. This is the amount of amino acids available for rebuilding the body. It's also a kidney function test, but it's at higher levels. Okay, we start rebuilding the body, and 15 is a good place to be. You get below 13, we don't have enough raw material to rebuild. But the BUN going down to 4 and staying at 4, hey, that's low. That's in the bottom 100th of 1%. We just don't see that inability to reproduce things. That's getting pretty serious. And the albumin, that's the first place I look in a chemistry. This is the most important chemistry. Of course, I say that about all of them. Albumin is the primary transporter of nutrient throughout the body. And 3 years ago, I ran into a half a sentence in a book. It said, of course, albumin is the primary detoxifier in the body. I've been doing this stuff for 40 years and I'd never run into that. So I called Boyd Haley. And I said, is this true that albumin is the primary detoxifier in the body? And he said, yes, it is. And I said, well, how come I've never run into this? I mean, is there some book where I can read on albumin and see what it's doing from the physiological standpoint? And he said, yes. I said, well, give me the name of the book and the author, and I've got to read that. And he says, I don't know the name of the book, but the author is going to be Hal Huggins. In the last 3 years, I have learned a whole lot about albumin. It is true. I may have to write at least a chapter in a book on it. But albumin is absolutely significant. 4.6 is where we need to be. Grams percent, not milligrams. That needs to be changed. Let's go back. Yeah. I just happened to notice because we just made these slides here. And it is grams percent, not milligrams percent. But then going back to our old friend, diphtheria inhibits protein synthesis. I was not hitting protein metabolism hard enough. And now I know why. I was hitting it hard enough for somebody else. But for breast cancer, I don't know. At least for this woman with breast cancer, I did not do a good enough job on protein metabolism. But protein, at some time, You got your feet out of the aisles? At some time or another, protein, at some time or another in its life cycle, protein walked. Fish don't walk. Fish does not show up in the blood as protein. Vegetable protein has a different third-dimensional conformation to it than animal protein. And though a vegetarian can do fine until he becomes mercury toxic, or has a problem with a root canal, or becomes ill, we cannot see an improvement in people as long as they're on a vegetarian diet. To the point that I tell people, if they call, they want to go through this program, and I find out they're vegetarian, I say, I don't think it'd be worthwhile for you to go through with it. They say, why? I say, because I don't steal from people. And if I take your money, I'm not going to give you anything in return. Now that's not exactly true, because we can make some improvement, but not like what I expect and not what they expect. And so it's going to be a failure, and it's going to be my failure. So, no. I have found, and I had to go to the University of Colorado School of Pharmacy to find out the reason for this, was that the third-dimensional, three-dimensional conformation structural form of vegetable protein and animal protein are not the same. They do not substitute for each other. So if I've got a serious problem and I'm trying to turn it around, I'm not going to be able to do that. There may be people out there who can do it. Fine. I have no objections to that. I know my limitations. I can't do it. So I do not handle somebody unless there is the protein metabolism that I know how to control. And on this case, I did not control it because I didn't realize that diphtheria was present in there, inhibiting the protein synthesis. And that's why I could not make the chemistries move. Now, our current chemistries on BUN has gone from 4 to 4 up to 9. We're still low, but we doubled it. We're making progress. Albumin, I've got to get that above 4.2 or I'm not going to make it. She went 4.1, 3.9, 3.9. Today she's 4.3. Now she's going to make it. Because I cannot get these things to turn around if I can't get protein metabolism straightened out. She is straightened out. But had I known a few months ago what I know today, we would not have had chemistries down. But if I didn't have the chemistries, I wouldn't have known what I didn't know. So this is why we use the chemistries to figure out, to do the walking through the yellow pages. And so many women with breast cancer don't die of breast cancer. Why? Because they die of heart attacks. Why? Let's look back at those bacteria we found in the root canal. Enterobacter, major cause of heart problems. Gamella, acute invasive endocarditis. Haemophilus, fatal endocarditis. Clostridium difficile, disturbance in heart function. Prevotella intermedia invades the human coronary arteries. So that's why breast cancer is not going to kill her. Heart disease will, but it comes from the root canal. And this is the one thing that Weston Price showed, was that 100% of the time he could extract a root canal tooth from somebody who had a heart attack, put a piece of the root under the skin, the belly of a rabbit for as many as 100 rabbits, and transfer a heart attack to each one within 2 to 3 weeks, 100% of the time. So how is that possible? I'm suggesting this is how that's possible. So this is something that does not really fit this group, but it fits some dentists in general. I'll let you read that. Okay, Weston Price, am I carrying on your work? This is what I have to say about root canals, and I appreciate your really undivided attention. You've been a great audience. Thank you. Enough to show that there's a difference.